taking a breath, and welcome to our discussion. My name is Reverend Julie Conradi. I am the settled minister of the Unitarian Universalist Church of Birmingham, and I formerly, before I came to Birmingham, served as a hospital chaplain and accompanied over 800 people through their last transition into death. And so I was really honored to be asked to moderate this panel this evening, as this is an issue that is dear to my heart, and the ways that we can all transform the ways that we think about death and life that goes with it. So welcome, and I'm going to let our panelists introduce themselves.
Thank you. My name is Aditi Sethi. Hospice palliative care physician and end-of-life doula and musician. I live in Asheville, North Carolina. And it's wonderful to be here in Birmingham. I moved here 20 years ago. I lived here, I worked as a research assistant at UAB. It's good to be back. And I met my beloved husband here. He grew up here. So thank you for having me.
My name is Rushil Patel. I'm primarily a hematologist, a physician here at UAB, done training in palliative care. And my story's backwards. Most of my life was in North Carolina, and I've resettled here for the last year. And Birmingham has been very hospitable. And a lot of my research focuses on sort of cultural considerations surrounding end-of-life care, as well as palliative care, with a focus on individuals with cancer and their caregivers.
Good evening, everyone. My name is Monica Thompson. I am a Methodist minister, and I am the spiritual care manager with the UAB Center for Palliative and Supportive Care. In my role, I provide chaplaincy, I provide counseling, and program management. In my downtime, I'm a Methodist minister.
Good evening, everyone. My name is Sylvia Huang. I'm originally from Taiwan. I'm a human being. I'm a daughter, and I'm also a palliative psychologist. I'm particularly drawn to end-of-life care, grief, and trauma, and I just love being here with you.
Hi, thank you for having me. My name is Manjuri Sharma. I'm a visual artist. I'm born and raised in Mumbai, India, and live in Los Angeles. I've been in a residence, been an artist in residence with UAB, been working closely with AVA and the Arts and Medicine program. I'm also a daughter, also a human being, and very happy to be here.
Thank you all. It is delightful to be here with you this evening. And I must say, may we all have the level of love and attention that dear Ethan had at the end of his life. There are many types of death. There are many ways that we can go. Not everyone has advanced warning and the ability to surround themselves with such a loving environment. And so there are things that we can do to make that possible. But before we begin our journey, Aditi, would you start us off by defining conscious dying for us? And specifically, how does one broach conscious dying with folks that are unable to respond to questions?
When I think of when I say the term conscious, it is a term that is used in medicine oftentimes. But when I speak of conscious dying, essentially we're speaking of approaching this inevitable journey that we will all encounter, whether it's anticipated, sudden, traumatic, unexpected, with our eyes wide open, with understanding, awareness, and presence, like Ethan so beautifully showed us, to be present with each emotion, to not just ride on the waves of the emotional reactions to things, but to really get to the root cause. My mother is in fear. I understand, but I'm not going to tolerate that. It's not, so that sort of clarity, understanding, precision, and awareness, I think, defines conscious dying to me. And in many ways, Ethan's whole life prepared him for that, for his crossing. And so if someone is unresponsive, unable to share their experience with us, it is challenging to know. you know, what our loved ones are experiencing. My father, for example, he had an unexpected fall several weeks ago, 8 weeks ago now, and he had a traumatic brain injury, and he was in a coma for 2.5 weeks, and ultimately we extubated him. Still hard to believe. But I knew what his wishes were. He had been very clear with us. He was a physician, and he's partly the reason I'm so comfortable with this conversation. I'm grateful for that. And I can't stress the importance of having people in your lives understand your wishes and who you are. And so I knew he entrusted me to support in this decision of pursuing comfort when it was clear that he wouldn't want to live this way. So I think the answer is have these conversations, open your hearts, be vulnerable, and it does take courage and honesty. So I'll leave it at that.
I lifting up that not all families can have these conversations, and sometimes children cannot hear what their parents are telling them. So I like to encourage the elders in my community to also tell friends and their minister and other people, so that, because when the time comes, folks that aren't as comfortable dealing with death, often, you know, they are more focused on the loss that they are about to have of you and aren't able to remember all those things that you told them. So writing things down, telling other people as well is really, really helpful. And he was blessed to have you as a daughter to be able to have those conversations with. Would anyone else like to talk about the question? Good. Well,
I would like to add that it's just, I just want an observation that it's just so beautiful to watch how conscious and how open he was towards his acceptance was so high. Let's say I have a question for Aditi. If someone is not in that place, do you do something to bring them there?
Yeah, thank you for that question. I worked in a 26-bed inpatient hospice facility for 10 years, and it's a lot of encounters with people who are facing this moment. And I quickly learned that despite every ounce of love and presence and openness that I brought to the bedside, I couldn't shape the experience for the person. So it's really there are times when people die the way that I would wish they wouldn't, you know, but I let go of that expectation. And you have to meet people where they are. So not everybody goes with that level of acceptance, at least on the surface. We don't know what's happening subconsciously on the different realms of, you know, our being, but yeah. So it's not always the case that people, it's very rare, I would say. And that comes back to our death phobia, our lack of exposure to death and dying in our modern world, our avoidance of death. So I think there's a lot of reasons for that, but yeah, it's rare. Thank you.
that brings us into our next question. We are very much a death avoidant culture. We are an age avoidant culture in many ways. And so there's lots of ways that we do that, but how can we transform Ethan's message across cultures where death and dying are not embraced, specifically our own, but others as well? And Monica, would you start with this one?
Sure. So first, I would say in some of my cultural contexts, if I were to give Ethan's message, like to my church, to the community that I serve, they may look at me and say, Pastor, did you take your medicine today? So, but a way that I can introduce that to them is beginning to craft the conversation. Sister Jones, if you had the opportunity to craft your own death, to write the way that you were to die, what would that look like for you? How would you tell that story? And that's your unique story. It may not look like Ethan's at all, and his story was beautiful, but it was uniquely his. And so Sister Jones would have her own unique way of doing that. Thank you.
When I heard this question, I interpreted it from the lens of even medical culture, because I feel like within medicine, and it wasn't until training in palliative care that I came to realize this, but in medical school, when we were asked to do a medical interview, we focus on the disease, sort of the past medical issues, past surgical issues, is what diseases run the family, and then we get to the life outside of someone's illness. In palliative medicine, it's sort of the other way around, and it struck me as novel when I went through my training, where we talk about the person. I was in a cancer hospital where I did my training. We didn't start with the cancer diagnosis stage and all that. We started with the person. Who is this person? Who is important in their life? What are their hobbies and what are their interests? And I find that that frame of that mindset really shapes sort of some of these conversations, because when I'm with my colleagues who haven't had that exposure, that experience, a lot of times the conversations that happen are things like the patient stopped responding to X, Y, and Z, or rather than the disease stopped responding to X, Y, and Z, or patient failed. That's like nails on a chalkboard every time I hear that. But like, patient failed this treatment. It's like, did really the patient fail the treatment? So there's this intertwining of the illness with the individual. And what I thought was so beautiful with what we just saw was that at every stage, like, Ethan knew that the illness didn't define me. That he had his own sort of existence outside of the illness. And I find that a lot of the conversations, and I started having the courage to correct my colleagues, as well as the nurses I work with, that when they start using that language, which is it's so hard to distance ourselves from it, but it's everywhere that I listen to it, trying to give that awareness and realization to bring back sort of the humanity, if you will, to the practice of medicine. So I think definitely this is one way I feel like within the medical system, medical culture, we can do this better.
Sylvia.
Well, I came from a culture where death and dying is a taboo. And also in my upbringing, because my dad has been an orphan early on in his life, so death is something I never mentioned. It's like, it means separation, it means loss, it means tremendous heartache. So growing up in that culture, to learn how to embrace death and dying is a process. And I would like to say that for people like me or people from similar cultures, I think we all have a way to embrace love. Okay, death and dying is part of love. Grief is love. So I feel like love connects us all. So I feel like, especially in my work, day-to-day therapy practice, grief work, if we sit down and listen and invite people to talk about their fear, their love, usually that opens up that conversation, because everybody desires to be loved until the very end. So that's how I feel like across culture, I know smiles are universal languages, and also love.
That's beautiful. I wanted to add to that. And so that question of how do we broach that conscious dying with somebody who can't communicate for themselves? So my mother had frontotemporal dementia, which means she lost her speech very early on. So she couldn't speak for herself. But if your consciousness was to not let go of looking hard and studying the new language that's being formed, there was still a lot of things that she was doing. It's hard not to focus on the thing that the person is not doing anymore, but there's still so much they're still doing. And she was still smiling. She was still touching, holding, So that was the person who was caring, being conscious, and being conscious of the consciousness that still remains in the person that you're caring for. And that taught a lot. That meant she was still teaching us a lot if we were willing to stare. So.
Thank you all. This movie really touched on the importance and the vital role of caregivers. And I think we even saw some of the exhaustion and the many feelings that caregivers go through as well as they are sitting vigil with someone toward the last of their days. And so, question for the panel, how does one consciously live while helping someone consciously die? Sylvia, would you like to start with this one?
I don't even remember if I started this, if I asked this question, but I'd be happy to answer that. I would say staying present here and now. A lot of times fear make us distance from our living experiences. We may live in another headspace, oftentimes ruminating. However, I think if we learn to stay present and stay connected, that's one way to do conscious living. And then when we can be stay present with here and now, even take a deep breath at this very moment. Even look around, even touch, even holding hands, even eye contacts. I think that's the best way for us to stay connected and also helping our loved ones. Right now, I'm a caregiver for my dad who has dementia, and then he's in his process. We don't know when, how, and all that. I'm learning every single day how to help him conscious living because he's still teaching me every single moment what he wants, what he doesn't want. Maybe not through language, but with his facial expression. And sometimes he yells at me or scolds me, but still, that's a matter. So through that, I think that's a great way of staying present. And one thing I have learned in my caregiving journey is that one of my friends, they are a couple, they came over to my home and I was a newbie, a new caregiver, I didn't know what to do. And they said that, listen to him, learn from him. Don't make judgment. Don't think what you think is best. Learn from him. So from that day on, I kind of, okay, teach me. So I think that's how I try to stay conscious and also learn to sync with my dad's conscientiousness.
I mean, I feel like I did answer part of that when I spoke to the previous question, but I always thought that was really amazing in America. You know, the show must go on. You know, this idea of the show must go on. And when I experienced the transition of my mother in India, the show came to a stop. You know, it was like days and days of mourning and staying with the feeling, you know, not rushing through it. So to speak to that death avoidant culture, and to just speak to being present with whatever is happening and unfolding in front of you. And for me, as an artist, it was to make art in response to what was happening. But everyone's consciousness is uniquely theirs. So to speak to what you said, asking someone, what is that thing that keeps you conscious? You know, whether it's dance, whether it's, you know, whatever combination of ritual, geometry, performance that makes you become present. Yeah.
Beautiful. I just want to add that I love what Ethan says about, does dying have to be a solitary experience? You know, we, in general, in our modern world, we're very individualistic. And asking for help in these vulnerable times is not effortless. It's not natural sometimes. But it takes, you know, as a caregiver, and you have to wear your oxygen mask first before putting it on your loved one. So just remembering that self-care, asking for help, taking breaks. You know, sometimes it's a marathon, not a sprint. In our case, with my father, it felt like a sprint. You know, we still took care of ourselves, and my mother wouldn't leave his bedside, so that was the sprint. You know, she just did that till the end. But we took breaks, and we were nourished by delicious Indian food from our aunties from Augusta, Georgia, that came to Ashra. That brought me in the moment and connected me to my senses and the moment. You know, so presence to me. Music has also been a balm for my soul, and was, you know, very important to Ethan as well.
Thank you. So one of the considerations, especially having this event at UAB to consider, is how we teach our future doctors about death and dying. My brother was in medical school most recently in my family, and he said the lecture on death and dying was 15 minutes long. And obviously we want our doctors to be focused on keeping us alive, right? But there's also a sense of maybe we need to have a little bit longer lecture of some understanding here. So, Rashia, would you speak to how can clinicians better support the cultural considerations of patients and families near the end of life?
Absolutely. I feel like one thing that kind of gets lost in the mix is, culture. There's a lot of things that factor into culture. And one thing that I learned in my palliative medicine training was the role of religion and spirituality, which I thought we saw a very clear multiple instances of in what we just watched. And when I was in New York City, frequently as a palliative care clinician, we would be called in and sort of in the last moments because there was always some quote unquote faith leader involved. And it just occurred to me as like, why do we have to wait to the last minute to invoke sort of religion and spirituality, and so, well, thank you. And it just, and what you come to realize is a lot of, when people are in these situations, they're looking to their sources of community and support. And if we as clinicians don't acknowledge those proactively, and so now as an independent physician, this is one thing I ask folks is, who helps you make medical decisions? And I even ask specifically, is your pastor involved if they identify as Christian, but is your pastor involved? And every now and then somebody will say, yes, I talk to my pastor. I like to keep them up to date. And I even offer, would it be helpful for us to have a meeting together, particularly if they're dealing with a complication or some other serious illness. And so I think one thing specifically is just being more mindful towards like religious and spiritual considerations, because I feel like as doctors, we don't do a good job of that.
Actually, if I could speak to that. So when we put in consults at the beginning, it makes such a huge difference than waiting as they're taking their final breaths. The chaplain will call, can you come be with this family as their loved one dies, as we do this withdrawal of care. It's such a huge difference when we are there from the beginning and we have walked that entire journey with them, whatever that has looked like. The ups, the downs, the highs, the lows, the fear, the pain, the agony. We are there the entire time, and that makes such a huge difference. And it helps to transcend that experience, not just for the patient, but for that community that surrounds them as well. Give us a consult at the beginning, Doc, please.
I also want to add, I've already forgotten the question, but this feels important. I think as long as we continue to feel that we are separate from nature and we reduce human beings to the biochemistry, the physiology, the physicality, I think we're missing the human piece to this puzzle. And I came to realize that it's not necessarily up to the medical system to shift our approach to death, which is what the end-of-life doula movement is showing us, that community is asking for more, asking to remember that death has value and that it has a place in our lives. And it brings us preciousness to each moment. So I think it's up to us to advocate for that before we become patients. Because we're humans, we're daughters, etc.
Aditi, how long did Ethan live? Did he go beyond 15 days in his last?
Yeah.
14. That's a beautifully long time.
It's a long time. He was so, they thought he was too fragile. He was originally, when I met him, in an inpatient hospice in Charlotte, 2 hours from us. And the nurse practitioner refused to transport him to us. She said, oh, he's too fragile. He could die en route. And so just to speak to, I think when he was surrounded by love, which is not uncommon, especially in these community models, once somebody's been bathed in love and held and supported in holistic ways, they often linger a little bit. they're soaking it all in, which he spoke to. He struggled with that desire to be at his party and also acknowledgement that he was leaving as well. So yeah, it was a process for him.
I have something to add. As an educator, as well, I believe in early exposure, not only early referral for counsel orders. I feel like for medical students, even college students, we show them this film early on, first in, last out. So I think integrate early exposure to cultivate familiarity, because familiarity chase out fears and awkwardness. So I feel like early exposure to intentionally introduce them to this is part of medical practice, this is part of life, this is part of how we celebrate life and honor life would be so important. Yeah, and that will save a lot of, I would say, headaches, heartaches afterwards if we do too late of referral. People don't get to have this amazing exposure to a beautiful death and dying process.
Thank you for that transition. This film was so epic in showing that we need to offer multiple sources of dignity to our loved ones as they pass. You know, we saw the haircut, we saw the various religious representations, we saw the singing, all of the wonderful things that were happening. And I think another important piece that the film highlights and raises questions about is that it's important for us to understand misconceptions about the dying process. The conversation that Adithi had with his parents over pain medicine. I can't tell you how many patients, and I'm sure everyone's nodding here, where the family's like, oh, they don't want to be addicted to morphine before they die. Okay. We want them to be comfortable, right? And so that would be one. And the other one that I encountered all the time was, well, my loved one's hooked up to all these machines, but they're going to go in God's time. And I'm like, God has already spoken. These machines, you know, with modern medicine, we can keep a body alive for a long time. The longest patient that I had in that state lived for 1.5 years. Not being able to respond, not having any sort of what we would describe as consciousness. It was a really difficult ordeal. And so figuring out these things and talking with your families about those things are really important. And so we have some questions from the audience, but I want to make sure we get to what resources you all have here in Birmingham that help you with end-of-life resources that mimic and support, just as Adithi's program does in North Carolina. So Sylvia, would you tell us about those?
Yeah, many of you may have heard about UAB Center for Palliative and Support Care. If you have not, Google it, okay? Through the Center for Palliative Support Care, our director, Dr. Rodney Tucker, is sitting right there. We offer a lot of medical and nursing and also holistic programs, one of which is over our Palliative and Comfort Care unit. It's simulate home setting. And we have family caregivers tell me that if something were happen to them because they experience caring for their loved one there, they said that although I live in Florida, please ship me here, okay, to be loved in a holistic way. So I would say it will be ideal. I would love to sign up for Ethan's dying experience myself. It will be lovely that way. And locally, just want to let you know that that's our Palliative and Comfort Care unit is one of the resource. Of course, there are local hospice, there are home-based palliative care, even nursing home hospice units as well. And also outpatient-wise, talking about early integration of palliative support care. We do have an outpatient community-facing clinic called Support Care Clinic. Contact us, okay, and reach out early on. You don't need to wait until the very end. Across the illness trajectory from day one, you should have a holistic team partnering with you, supporting you and your family, your loved one. it's a lot of anticipatory fear, anticipatory worry, anticipatory grief. Also, it will be so awesome to have a team who specialize in symptom management, quality of life, and rally you with lots of love and support and connections, not only for professional caregivers like Monica and like Dr. Tucker and like Dr. Dan Tucker over there, with physical therapy, massage therapy, with exercise physiology, with everything like you can think of, from medicine, from nursing, to provide that holistic care, to facilitate that process, that transition across settings. If I missed anything, feel free to chime in, or we can discuss further.
Thank you, Sylvia. There are a lot of practices in the film that loved ones can do as well, whether they're in the hospital or at home. There was a lot of attention to Ethan's environment, the windows, the lighting, the comfy blankets, the music, the sound, the smells. He requested his essential oils at one point. So I think that's really important to point out. Scientists have shown that we can still hear up to 15 minutes after our heart stops. And so that is the thing I tell folks who are with a dying person all the time, of be mindful of the sounds. Read, play music, talk, but be mindful that they can hear whether or not they can respond. And so I think that was really important as well. Monica, would you talk about some of the holistic medicine practices that are available here in Birmingham?
So, really, to piggyback off much of what Sylvia just said, through the Center of Palliative and Supportive Care, we offer such holistic medicine. We are concerned about mind, body, spirit. We do have movement, and if you saw how much movement gave Ethan so much energy, so much joy, in addition to music, we have music therapists, we have art therapists. And so we are so inclusive. And so that's considered complementary and alternative medicine. And so rarely throughout this state will you see so many programs that are so inclusive, like the Center for Palliative and Supportive Care. Yes, I'm bragging. So, but you want to be in a place where all of your needs are being met. And if you notice, the first thing Ethan asked his mom when he was brought to the bed at that home, he said, just put your arms around me. The importance of touch. Healthy, beautiful touch, and the music, so many other things. So providing holistic care is such an important part of the dying journey, to include, as she shared, the exercise physiologist, additional healthy touch, nutrition, what things are healthy for me to eat at this stage, what can I eat, what can my body process. That all makes a difference when we're on that dying journey.
Thank you. We have a lot of questions from the audience, so I'm going to, weigh in as you can, but we're going to try to get through as many as we can. For Aditi, can you explain the significance of each of the 3 E's in the context of what we saw in the movie?
Yeah, what a great question. We call this the E3 mantra, or affirmation. And when I first heard it, I have to say I was kind of confused. I didn't get it. What do you mean I'm embodied, I'm empowered, I'm ecstatic? But as I went along the Ethan journey, by the end of it, I really felt into each of those words and the power of being embodied, being fully present in my body. I was terrified of being in front of a screen or a camera. And I just let go of all those fears and just showed up fully present in my body as a vehicle to serve. So the embodiment piece was amazing. I'd experienced that with my pregnancies, but never fully in service in this way. And I'm empowered. And that I was empowered to do what my soul and my intuition was guiding me to do. When the facility I worked at for 10 years said, absolutely not, no filming, it's too risky. Something negative about hospice might be leaked. I had a moment of choice there. My heart sunk, my guts, everything just shifted. I thought, oh my gosh, do I allow fear to dictate this journey, or can I see what the alternative might be? So that empowered feeling really resonated with me, the idea of being empowered to live our lives fully. and to listen. And then the ecstasy that comes from that, from following our knowing and our bliss and all that has unfolded since then is what I think he's speaking to. Just heaven on earth, if you will. It's possible, I think.
Thank you. For any panelists, what is your experience with occupational therapy and palliative care? Do you think it has a place? Can anyone speak to that question? No pressure, Sheila. Everyone's looking at you.
Apparently, go ahead.
I was gonna say, one of the beauties of palliative medicine is that it's an interdisciplinary field. And while I don't have any direct experiences with occupational therapists, I will say, I think one aspect of palliative medicine is to support people wherever they are on their illness journey. And it just reminded me actually of a story when I was in the cancer hospital training, where this woman who unfortunately had so many communication barriers, she was not able to, so as a consequence of her cancer, first, she didn't speak English, was not her first language. Second, as a consequence of her cancer, there was a problem with her vocal cord function. So even if we use the phone interpreter, which are ubiquitous all throughout the hospital, was not able to actually express herself. And so with the help of the palliative care team, not necessarily the occupational therapist, but the palliative care team, we figured out a system whereby some of the common words that this woman spoke, and she spoke Arabic, so even trying to get the live interpreter was hard to come by. But we had some common words that kind of helped with sort of symptom management and things. We were able to put together sort of a visual cue guide, and so that she was able to kind of point to these different things, so that the bedside nurse at least knew what to do to address symptoms. So I think these are things that in some institutions it might fall in the purview of an occupational therapist, but if not, this is sort of what the discipline of palliative medicine does.
Thank you.
I would just add one quick thing. I think there's some people who are dying that have an illness that, with the support of occupational therapy, could be able to stay in their homes longer as they're dying, especially if they're independent. So I do see a place for it, whether it's reimbursed or not in our hospice system. That's the tricky thing. But I think it's valuable for certain cases, for sure.
Sylvia, I'm going to ping this one to you. This one says, I loved Ethan's joyfulness, but I also enjoyed seeing his anger while advocating for himself. Can you talk some on the range of emotions that someone with a terminal prognosis go through?
Thank you for that beautiful question. A lot of people feel that happiness, joy is to be honored, and anger and sadness is to be avoided. It's almost like a dichotomous way of kind of categorizing and separating emotions. However, to be honest with you, the flip side of anger is sadness, and what we are sad because we love. Okay, so all the primary emotions, whether it's joy, sadness, fear, anxiety, and all that, it should be embraced. And as human beings, we need to learn more about that for ourselves too, because even for ourselves, sometimes we try to push some feelings away. Actually, each emotion teaches something important about our existence, our values, our goals, why we care. And so in our work, we actually advocate for assertive communication, be vocal. And I admire how Ethan made it so clear. I'm an adult, I'm a man, okay? Nobody needs to tell me what to do, even my mom, even I'm on my dying bed, listen to me. So I think that appropriate expression of anger is important to shield one's territory and to have this communication. So if we all learn to honor our feelings and honor our emotions and learn, okay, what this emotion want me to help me take me to the next step, that will facilitate even closer connection. So there's a lot of anger management we do in our setting. We have people fighting on top of the bed when the mom sits laying there. Boys doing fist fight, and grief can be manifesting a lot of anger too, towards even the nurses and healthcare providers. So as healthcare providers, as family caregivers, as human beings, we all need to learn how to embrace that. It's not a bad thing.
Thank you. Ethan's suffering was difficult to witness. Are there more states in the United States any closer to passing death with dignity laws? Does anyone know about those?
Yeah, I know there's 11 or so states that have passed them, and there's always bills coming through whatever that's House, Senate, somewhere, one of those things. But I know North Carolina, the Dying Right North Carolina is advocating for medical aid in dying in North Carolina, but the bill has just never made it past the first tier. I'm not a very political person, but yes. So I think it's an ongoing conversation in states, but I don't know who's next to pass it.
I was going to point out, even though it's not directly or answering the question, was something that I learned in my training was that, and it was one of the early states, maybe it was Oregon, maybe it was Washington State, I can't remember. But in one of those states, when they had done sort of the survey of how many people who wanted death with dignity, having the medicine, only 1 out of 3 people actually used it. And so what was interesting, we had a speaker come and talk to us about this, was just this idea of loss of control. And then on the flip side, like what we just saw with when you have sort of community rallying together to provide this beautiful experience of death and dying, how you can circumvent those feelings of loss of control when we sort of embrace the dying process. So food for thought.
Thank you.
I also get asked the question, do you think Ethan would have chosen medical aid in dying had he been given the choice? And my sense is, knowing how Ethan lived his life, he was very connected to Mother Earth. He was deeply spiritual, had used a lot of plant medicine, very natural in his approach to life. I don't think he would have chosen to hasten death that way. But that said, I also, if you don't know, Vermont and Oregon lifted their residency requirement for medical aid in dying, so people can now go and access that support if desired.
What I thought was interesting in the film was the countdown. There was a story on NPR a couple of years ago about how even in states without death for dignity laws, you go without food and water for 2 weeks and you have made your decision. And I have had folks in my life who that is how they have ended their life, is deciding to have that final fast and make the decision that way. It's not probably as peaceful as the medicine would be, but it is just as effective. So I thought that was kind of telling that the countdown was exactly 14 days as well.
Yeah, and so that when it's voluntary, it's called voluntarily stopping eating and drinking. VSAID is the acronym. And I get asked that question as well. Did he voluntarily stop? And he did not voluntarily stop. He had, the day I met him, even a drop of kombucha, which was his favorite drink, caused him to aspirate and cough incessantly. So he was physically unable to safely swallow.
Thank you. Could you speak to how a connection with nature might help us with our death phobia? Anyone like to take this on?
I think it's so luxurious that he could face those mountains. I mean, I'm just facing the fact of Ethan opened himself up and asked for a family, and he got it. He like received. He gave his whole life, and he was connected to nature, and nature brought him closer. At the end, but when I just decode that word, nature, to be natural with the person who is in your arms as they're going is to, fight back force systems of like artificial management that will put them through more pain. So not everybody can face the mountains, but you can be real with them, as simple and as natural as possible. And that's still bringing them closer to their true nature.
Actually, I would like to jump in on that one as well. So, from my perspective, when I think in terms of connecting with nature, my own self-care has been keeping a garden in my backyard and watching to see if the same cardinal couple will come back and bless me with some babies again each year. And so they come back each year. And so I make sure they have a lot in the bird feeder. They've got everything. The squirrels can't get their food. The trees, their nests are protected. And so, and watching their babies hatch, I feel like those are my kids. I'm raising those kids with them. And so I am so grateful that I have given myself the permission to slow my life down to see how I am connected to nature. And when I go to my family farm and I go and speak to the cows and how they utter back to me, and the babies run because they don't know me. I don't know you yet. And so that is a connection. That is an absolutely incredible connection. But I have to be mindful to slow myself down so I can see that that is how I'm connected to nature. Without that experience of being in my garden, with my hands in the dirt, without watching my cardinal family come back each year, I'm disconnected. And I know I need to go be outside for a little while.
Beautiful. I just want to add one thing, that we are nature, right? When after having supported individuals in their after death care, including my father, I'm struck by, the physicality of our body and what's going to result in the decomposition if you're buried. And when you look at the cycles of life, death, rebirth, and nature, it reminds us blood that courses our veins, it's, the water in our bodies, the air element of breath, the fire, digestion, the earth, the bones, the matter. So, yeah, we are not separate.
So one thing I forgot when we introduced ourselves, I focused on my professional identity, but looking at this right now, my 3-year-old son is getting ready for bedtime with my wife, who has the honor of doing it tonight. But even with him, as we go walking and we see, this is the age where curiosity, and he'll say, like, what's this? What's this? What's this? And if there's like a dead insect on the sidewalk, we point it out and say that this is a dead insect. We just, it's not something to be afraid of, not something to be ashamed of, or something that we're trying to hide. And I do think the more folks see this sort of around, that's sort of like the changing the seasons. And, we see this a lot, I think, in various traditions within sort of South Asia, like Hinduism, which I'm most familiar with. Without birth, there's no death. And one of the sayings that I think sort of encapsulates this well, and it's translated in English, is that we came into this world with surrounded by everyone with tears of joy. Live your life in such a way so that they may also shed those same tears of joy as we pass on to the next life.
Thank you. This next question we could spend an hour on, so be brief. But in your work, have you found young children are sometimes very capable of understanding death? Monica, would you like to start with that one? Pretty good.
Oh, me, okay.
Mm-hmm.
Yeah, so I will share. My father died in February, tragically, all of a sudden, and I wish he would have had a beautiful transition like Ethan did. And so I have a 6-year-old niece, very precocious, very perceptive. And so she came in right after my father died. So she was saying, Mimi, meaning my mother, her grandmother, she said, Mimi is so upset since Papa died, my father. And I said to her, Autumn, what does death mean? What do you understand about death? She said, Auntie Mo, it's when everything just stops. You can't talk anymore. You can't do anything anymore. And everybody is sad and they're crying and they're hurting. And she got it. A little child had just taught her aunt, who's 48, and so she got it. And I said, Autumn, that is a beautiful way to say that. And she said, but I'm going to give Mimi hugs all the time. So she was able to recognize in her 6-year-old mind, I need to offer her some comfort. I need to give her some compassion because she's grieving. And she recognizes that she, as a 6-year-old grandchild, was grieving as well.
I would like to add to that. Over our healthcare unit, I've witnessed some of the most beautiful, amazing children who embraced death beyond our adult capacity. Okay, I remember there was one 5-year-old girl. She was invited to join her grandma, who was, of course, in her dying bed. She curled up, hug her, love her, kiss her. Just they were like one. Okay, and then when we do the legacy project, like we do some sprints, like love you, and make a heart. And she just like thoroughly kind of embraced that and just love you, grandma. So I feel like as adults, sometimes we worry so much, we underestimate kids' capacity of understanding. They are not as afraid as we think they are. And if we are opening the doors for them to access the death and dying process, that's actually a beautiful lesson they can learn for their life. So I would say death and dying is really life care. Okay, and children are super amazing. They can teach us a lot of that.
They are. I would say we need to be careful about the euphemisms we use around children, especially around death. The big one recently is to not describe to children that someone has gone to sleep, because then it makes children afraid to fall asleep. And so, the euphemisms are something to be cautious about. It's important to say heart stop and brain stopped and, the things that Monica was describing as well. So I want to lead into our next question. I know everybody's anxious to talk more, but Dr. Patel, can you comment on the analogy of people saying the euphemism losing their battle?
It's funny that question was asked because that actually ran through my mind when I was watching the film. And I have very mixed feelings about it. Particularly, we call these like violence metaphors, military metaphors, because I've heard both perspectives. The perspective from, at least from a clinician standpoint, is I feel like when we treat this as sort of a zero-sum game, the challenge with telling someone, oh, we're going to fight this cancer, is when it sort of implies that there's some sort of control. And I think there's control insofar as someone comes to their appointments and gets the treatment, but ultimately whether or not that treatment does what it's supposed to, it's not necessarily within our hands. And so then when we get to the point where the disease is no longer responding to treatments, then you see it everywhere where somebody lost their battle to such and such. And I feel like there's a lot of angst and negative emotion that gets created from that, because it's like again, that feeling of loss of control. At the same time, I've heard physicians who themselves have been diagnosed with cancer still refer to their illness, as a fight. And so then you're kind of stuck in like, how am I to read into someone else's experience? And I think sort of the way I've come to terms with this is, I think whenever someone has an illness, right, it's a threat to one's identity and how they relate, and so on and so forth. But as a physician, I feel like I would be amiss if I framed things in that way. So if someone were to tell me that I feel like I'm fighting this illness, I can acknowledge and support them, but I would be hesitant to frame things in that way, just because I know, if things go unexpectedly, the way it would be framed would result in a lot of negative emotions.
This next question's for you.
And then we're ultimately setting ourselves up for failure, because we're all going to lose the fight to death, right? We're all failing. There's nobody.
You're all failures.
F.
Yeah. So this question is for you. I wonder how you were able to keep your two roles as physician and as a doula separate. When Ethan was dying, did you ever feel drawn to provide medical as opposed to doula care?
Thank you. I wasn't. It's actually kind of refreshing to take off that hat sometimes and to just bring my whole self forth, independent of that role. That said, when his medicines needed adjustments, I wish I could have just asked the nurse next to me, hey, could you just go up to 5 milligrams of Versed or whatnot? So there's that impatience, but really, no, it's was pretty effortless and has been. I'm in the community supported model, the Center for Conscious Living and Dying. I'm the executive director, and I'm not acting as a physician there. So I get to practice taking off that hat a lot. And there's the same thing applies. Some impatience, but otherwise it's refreshing.
Thank you. Our last question, and then I'll give everyone a chance for a final thought. So if you don't want to answer this question, you'll still get a chance to say something. But the question is, do you think that those who are at the end of life fight to stay alive because they aren't ready or because they haven't accepted the path their life has taken?
I know a few years ago, we have a family who really struggles because the basically based on prognosis, best medical knowledge, the patient should transition already. And then what happens, prolonged lingering cause a lot of distress on the families. There are so many things mysterious, like the sound, the beautiful sound of sound. We don't know. And so in the face of that prolonged lingering, there's something that's hanging on for them to hang on. A lot of times it's hard to tell. Nobody can tell what's really going on, why they're still hanging there. And I can't say for people, but I've sensed that there's love there, some love. They're not ready because there's something they're still hanging there for. And I do have many patients who are miracle patients. Like in terms of prognosis, they're probably should be gone several times, but they are determined. They makes up one milestone and then exist to the other. And people may think you are fighting death. And one of my current patients, she has taught me so much. She's really in her final months right now. And she said, I'm not afraid of death. I just want to be here with them more. So, and she's willing to endure the pain, the suffering, and the symptom burden in order to be there more for her loved ones. It's my observation.
So I would absolutely join that, Sylvia, and I would say that I had a patient to tell me over the last year, my will to live is greater than my prognosis. And so this person wanted to complete some goals before the finality of his experience here. And so he was able to do that. And I suspect it may be the will to live. It may be something within the family system. It could be the love that connects them here, which is so beautiful. But it's like you said, it's up to the individual.
Sometimes that will to live can also be a surprising thing to witness. So I had like just right before the pandemic, my mother was giving all the signs of she had stopped eating. So my dad was like, "We're putting food in one side, it's coming out the other. You should come now." And I wasn't prepared for that moment. I remember making a phone call to 1-800-Alzheimer's, the association. I'm like, I'm a daughter. I just want to understand, when this stage comes, do people come back from this stage? And I remember them saying, "I just want you to know that you're a really great daughter," and they went into a direction where they did not really answer my question, but they did, and so, we packed our bags. I took my kids and we went there. They were keeping my mom alive by giving her insulin. No, sorry, IV fluid. And my children gave her one bite and second bite and another, and she lived for 2 more years. We were sure she was. It was miraculous. She was skin and bones. I have pictures of her, like us just loving on her, and it was magical.
I think I've also seen so many times folks who are in the dying process who hold on for their family to get there. And then there's also so many times where they wait for everyone to leave the room So regardless of where your family member is on that continuum, don't be offended. They have a preference. It's very clear most of the time. All right, with that, I'd like to see if anyone has final thoughts, and Marjorie, want to make sure that you, I'm going to let you finish the final thoughts so that you can invite folks to the art show. So, Aditya, would you like to start?
My heart is so full. I'm feeling so grateful for this opportunity to be on this panel with these amazing beings and to be in this space. And I just want to say thank you. Thank you, Risha. Thank you, Kimberly and Suzanne.
I think it was certainly a privilege what we all saw in the first hour and a half to open up, the entire experience. I mean, obviously Ethan, his family, and your team, I think it's grateful to see that, and it just teaches us how individualistic this experience can be, across communities and families, and that's what draws me to this entire field and process.
So I do want to say thank you to Kimberly Kirklin for extending the invitation for me to come and be a part of this amazing panel and experience such beautiful things. But to quote E3, I am embodied, I am empowered, and I am ecstatic.
E3. And also, my final words is that when we step out of this beautiful, beautiful building, look up and be connected.
I mean, I knew this was going to be a lot, but I really feel like I got to revisit something that I didn't get to be as close to. I wish I wasn't the one finishing this conversation. I've had an amazing experience working with UAB, and I have a show opening at Ava, which is across the way. I don't know why I'm doing this. There's a public reception tomorrow. There's also a hurricane, so if you can make it, please come out.
You could shelter at home, or you could come be with Marjorie with her art.
Risk your life.
I will say
You have a choice to make.
you said talking about death had to be, droll and boring. This is wonderful. Her art show, since it's hard for her to talk about, is about the journey of grief that she has gone on with her own loved ones that she has lost. So I do hope you will go out tomorrow night and see the show for the opening. And if not, I think it's going to be around for a couple of weeks as well. So please join me in thanking our amazing panelists. I'd like to thank UAB for making this happen, especially Kimberly and Suzanne. And especially the folks in the back who think they're invisible but are making all of this work, our AV crew. And I especially want to thank Aditi and for sharing Ethan's story with us. And for Ethan, wherever you are, I hope that you hear our gratitude and our thanks for sharing your path with us. Thank you to each of you for being here. I hope that this has brought you further along on thinking of your own mortality. And our panelists will be available out in the lobby for questions afterward. We also have a bunch of resources about continuing education or other learning opportunities or other ways you can participate in being with others on their dying process. Thank you all so much. Have a good night and drive safely home.